Hi, my name is Amy Greensfelder, and I'm the Executive Director at Pro Bono Counseling. Our office is located in Baltimore, and we provide mental health support across the entire state of Maryland. Pro Bono Counseling's mission is to remove barriers and provide relief by connecting Marylanders to mental health support. At Pro Bono Counseling, we increase access to mental health care by connecting people who are seeking counseling to licensed providers who volunteer their time. There are currently more than 800 volunteer clinicians enrolled with Pro Bono Counseling, and last year they donated over 16,000 hours of counseling care to Maryland residents. Pro Bono Counseling also operates a free mental health WARMLine. The WARMLine provides on-demand telephone-based connection with a compassionate mental health professional. Callers who are expressing sadness, grief, worries, relationship stress, life transitions, and other mental health concerns can call the WARMLine 7 days a week and talk directly with a mental health professional for brief support. The WARMLine addresses many common barriers to mental health care, including high costs, time constraints, lack of transportation, technology difficulties, and stigma. Pro Bono Counseling serves individuals, couples, and families of all ages and backgrounds living in all counties in Maryland. The target participants specifically for the WARMLine are those over 18. If younger callers contact the WARMLine, they're provided with information, education, and referral resources. In order to rapidly build rapport with clients and reduce barriers, the WARMLine does not directly collect demographic data. However, this information is collected if a caller goes on to participate in counseling with Pro Bono Counseling. In a one-year sample of caller data, callers ranged in age from 14 to 91, with 35 callers speaking a primary language other than English. 22% of callers were over the age of 60. We do not directly collect income or insurance information on callers. However, when we look at WARMLine callers who go on to seek counseling through PBC, we have found that 100% of callers fall below 225% of the federal poverty guidelines and are either uninsured or underinsured. This funding will be used in support of the mental health WARMLine. The WARMLine began in 2020 to address the unique mental health needs felt during the height of the pandemic. However, over time, it has proven to meet a number of needs that existed prior to the pandemic and continue to be present, including social isolation and gaps in care. Last year, the WARMLine received over 1,500 calls from residents in all Maryland counties. It has been well received in rural parts of Maryland, where transportation and limited numbers of mental health professionals continue to be outsized barriers to care. The WARMLine is staffed by mental health professionals that offer brief interventions to Marylanders experiencing stress, sadness, anxiety, or grief. One staff member is bilingual in English and Spanish, and live interpretation services are available in many other languages. The WARMLine is not a substitute for crisis services or ongoing therapy. When callers express these needs, they are connected to appropriate resources, including local crisis centers and the Pro Bono Counseling program. This project aligns with Qlarant's mission to deliver quality, clarity, and opportunity, as well as the objectives of the foundation to improve access to care and quality health services for individuals and communities through projects with high impact results on health outcomes, with a focus on uninsured and underserved populations. Many callers to the WARMLine have not previously engaged in mental health services and express how easy it is to use, as well as the friendliness, care, and compassion of the WARMLine staff. Callers remarked that they were nervous to try counseling, but speaking with a caring staff member gave them the confidence to pursue longer-term counseling. As Maryland responded to the COVID-19 crisis in spring 2020, the United Way of Central Maryland's 211 helpline experienced a high call volume, with many callers sharing emotional distress. The United Way recognized PBC as a mental health leader and reached out to suggest that PBC establish the WARMLine to support these callers with their emotional needs. The Pro Bono Counseling WARMLine complements crisis services, and many callers express relief that there is a resource for people experiencing emotional distress but aren't in crisis. The Maryland Crisis Centers frequently refer callers who are not in immediate crisis to the WARMLine for ongoing conversation and support. The warm line fills gaps in the mental health care system and is frequently used by people who are on wait lists for longer-term counseling. Domestic violence programs frequently refer victims of domestic violence who are awaiting counseling. Many warm line callers go on to engage in longer-term counseling. As a counseling organization, Pro Bono Counseling is well suited to meet the mental health needs of Marylanders experiencing stress, worries, and sadness through the warm line.